Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. That's 866-870-5752. You get a free book, Dr. Darrow's latest, when you call the program today. That's Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And please go to the website at www.lastemcells.com. That's lastemcells.com, where you can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. So shall we go to Harold?
Yes, Harold, Dr. Marc Darrow. How are you today?
Dr. Darrow. I have degenerative arthritis in my left knee, and
okay.
I go to the VA, and they want to do knee replacement. Now, I had one done.
Okay.
I had one done on my left knee. No, the other way around. I had it done on my right knee about 5 or 6 years ago, and now my left knee is hurting. Well, it calms down with the diclofenac gel, but they want to do surgery on it, and the right one didn't turn out so good, so I was trying to see if I can avoid it on the left knee.
Okay. So let me tell you a couple things. I used to work at the VA in West LA during my residency at UCLA, and the VAs are generally pretty much run by the residents. Do you know what a resident is in medicine?
Yes, I know. I see them all the time.
Yeah, that's what you see. The residents are the guys in training.
Right.
Do you understand that?
Right.
Okay, so in med school it goes like this. There's 4 years of medical school, and then there is a residency, or maybe it's an internship for 1 year and then a residency. And they're all great guys who are residents, but they don't have the experience. Do you understand that?
Right. Well, they usually go ask their attendings if what they discovered is correct, and sometimes the attending.
That's exactly right. That's exactly right. They have an attending doctor who's an older guy who's experienced. Now, if you're in a surgery, do you want the resident to be asking the older guy what to do? No, you want an older guy who knows what to do.
Right, exactly.
So that's not, I'm not saying anything negative about the VA. It's a great, it's a great thing for our soldiers and people. And it's a great training ground for us residents back in those days, because it allows us to do things that other people won't let us do. Do you understand that? No, I'm just being honest with you.
I know.
So it's not like they're bad guys. They're great guys. It's just they're not going to have they're not seasoned. And something like a knee replacement, yours didn't come out as good as you would have liked it to. Something like a knee replacement is a very dangerous, in my book, a very dangerous procedure to do. I had one of my patients who had it done against my best wishes. He did it anyway, and he died from a blood clot afterwards. That stuff happens. I'm not saying it was the surgeon's fault, okay? I love surgeons. They do, I say this on every show. Surgeons do the hardest work in medicine. You sweat in there, and then you sweat afterwards when things don't go well. So, the reason I do regenerative medicine instead of surgery, because I was in training to be an orthopedic surgeon. I loved it. It's a lot of fun going in there. It's like doing a sport. It's a guy thing. You don't see a whole lot of women in orthopedic surgery, right?
There are a few now lately. More women are coming.
Yeah, there's a few. But it's more of a guy kind of thing. Usually the guys are 6'2" or whatever, and Not everybody, but it's guys who are jocks, and it's a natural for them. I was a jock, and it was a natural for me. And then I had the shoulder surgery in medical school, and I'm like, I'm not going to do that to people because it screwed me up. I don't think my surgeon did it on purpose. It's just what happened. Okay?
Well,
So that's not a place to, to me, to get a surgery. But nevertheless, let's talk about knee surgeries and knee replacements. I get people in all the time who have knee replacements where it failed. That's a big surgery. It's a dangerous surgery. If you ever saw one, you would never get one. It looks so barbaric to amputate the bones and then pound in things that have to fit together. And I just see way too many failures. So if you need it, go get it. Need it to me means your knee was smashed by a hammer and there's no knee left. You get what I'm saying? Or got run over by a forklift and there's no knee left. Yeah, get a knee replacement. But if you got a knee that all you need is a little bit diclofenac gel, which is an anti-inflammatory to feel better, that's not the knee to get replaced. That's the knee that a resident wants to operate on so he can get more experience. Do you see what I'm saying?
right. Well, I think they all do.
And I'm not putting down the residents either. I was a resident, and we want to do as much as we can so we get the experience. But VA to me is not a place to go to get a knee replacement, and I don't think you need one anyway. Just talking to you.
Yeah. Well, when I did the right knee, it was a lot worse than this left knee is now, and it's getting really knock-kneed.
Yeah. Okay.
So
well, that's a different issue. If is your left knee knock-kneed at this point?
Yes.
Okay. Well, you may need a surgery for that. I don't know the answer. I'd have to see it. Sometimes you can do a smaller surgery called an osteotomy, where just a piece of the tibia, a little wedge is taken out to straighten out the leg. Or maybe, that sounds like what you have if you're knock-kneed. But again, I don't know. I can't tell anybody on the radio what's going on with them until I can touch the body and see what's going on, move it around. But it may be very possible that stem cells and or platelets can help you heal up, because we can grow back a lot of the cartilage. If your bones are out of alignment, it's not going to fix that, I can tell you right now. But if you're just in pain and an anti-inflammatory is giving you relief, then it's probably something I can help you with.
All right. Well, it all started when, I guess it started when I got exposed to Agent Orange.
Yeah.
And so I have this peripheral neuropathy.
Yeah.
And the way they explained it, the podiatrist actually explained it, it said that I lost all the muscles, not lost, the innervation in my feet.
Yeah. I hear you.
My feet went flat, and that caused me to get knock-kneed.
Yeah.
And that's when the arthritis developed.
Could be. The point is, it doesn't really matter. What matters is
Right.
what do you do about it now? Agent Orange was one of those really strange things that the Army never paid for or allowed people to get taken care of for. I hope you got some good care, but I had back in the day.
Well, they're not covering me because you're exactly right. They told me that, we can't show it's from Agent Orange.
Yeah. Well, it's a tough one, but if you were not a drinker or if you didn't have diabetes, which are the two main causes of peripheral neuropathy, then who knows? It is possible. I've seen so many guys. I was in the service.
Diabetes. I'm sorry.
Sorry? No, it's okay.
If I had diabetes, I could get some kind of it could collect some kind of disability, but I don't have arthritis, and I don't have like the.
You mean you don't have diabetes? You do have arthritis. Yeah. So usually I can help people with arthritis, but I've got to move the knee around, touch it, and see what's going on with it. If you do want to come in, the phone number to the office is 800-300-9300. I'll repeat it for you while you're writing it down. It's 800-300-9300. And if you have a computer, go to www.lastemcells.com, lastemcells.com, and You'll read a lot about what I do. There's videos on the website injecting pretty much all over the body. And there's a YouTube channel. If you just Google in Marc Darrow MD on YouTube, you'll find endless videos. And my website has a lot of videos that you can take a look at right now if you want to.
Is it possible to straighten out the knee again, to make it straight?
I have to take a look at it. Sometimes it's just what we call a contracture, where because of pain you didn't straighten it out. And sometimes it can be and sometimes it can't be. And there's exercises to do for that. Have you had physical therapy to see if they can help you straighten it out?
I've had physical therapy, but they never mentioned about straightening it out again, and it didn't seem to straighten it at all. It did make it a little bit stronger.
Okay, well that's good.
And I still
sometimes the physical therapy needs to be done after you really heat up the joint. Okay, so let's say someone with a locked shoulder, frozen shoulder, they can usually fix that by themselves, just by heating it up real hot and then slowly stretching it out. I use a golf club to show people how to stretch their shoulders out. Now we like to inject the areas that have the injuries also at the same time with platelets and or stem cells to help it heal up. But sometimes just doing a stretching program can help you. I'd have to see you, Harold. I can't really do this over the radio. Okay?
Yeah. Okay.
How old are you, Harold?
79.
So you're a young guy. There's good hope for you.
Yeah, young.
Okay, I don't know if I ever told people who are my listeners. I had a guy come in his 90s and he looked like he was 60. He was working out every day, and I said, "How can it be that you're in your 90s and you're like a young guy?" He goes, "Because I never let the old man in." So keep your attitude where it belongs. Youth
sometimes
is something.
When you're locked down with COVID, you have nothing to do. You can't go anywhere. You can't do anything.
Yeah, well, that's an attitude thing, because I know plenty of people, and I'm one of them, that worked out in my garage and on the street. I put on my running shoes in the morning and I go running up and down the mountains where I live. And I've got a couple of...
I can't run anymore.
I know, but there are things, Richard, let's just be straight with each other. There are things you could have always done. You could do push-ups. You can do sit-ups.
Yeah, I tried it, but then you get so bored with that stuff.
Well, that's your choice. You have to wear a mask. If you want to choose boredom, choose boredom. I have a friend once who told me, you can go into the darkest hole in the world with joy and love in your heart, and you'll light that hole up. And you can go into the brightest place in the world with a bad attitude, and that place will have a bad attitude. So you have to have a great attitude to stay young. I know it. It takes work. But what's life about? It's all about being happy. If you want to be happy, you got to do happy things. So don't quit on life as you get older.
True, but you get reminded of when you can't balance yourself too much anymore.
I know, but Richard, look, I'm like this with my patients, so I'm going to be like this with you. I'm very direct. Don't get mad at me. I'm doing this for your own good. You have a lot of excuses. You don't find happiness with excuses. You got to just do it. The Nike byline, they have a shoe and underneath it says, "Just do it." And that's something, for all of us to work on. I don't have it down 100%, but I do meditate an hour every single day of my life, and that's the place I go to. I go to the place where I can figure it all out and do, what they used to call that, attitude dancing? Was there a song, Nita, like that, or something like that?
I don't recall that, but definitely a change in attitude is definitely called for. We need to stay positive.
And attitude is something that we have 100% control of, Richard. 100%. Sorry, your excuses I don't buy them. I love you. You're a great person. I can tell by listening to you. But you have a lot of excuses for life, and that's not going to make you happy. Sorry. You want to be happy? It's not tomorrow. There's only one time to be happy. That's now. That's it. And I always tell my patients this because they all have the excuses. They go, when I lose 50 pounds, I'll be happy. No, you won't, because you're setting up your consciousness to be waiting for happiness. And then when you get that thing, losing the 50 pounds, getting a new job, getting a new girlfriend, I don't care what it is, your consciousness is set up to be waiting for the next thing, because you'll come up with the next thing. You'll never be satisfied. There is only one way to be content and happy. That's right now. I'm sorry. I wish it were different. It isn't.
Well, I want to thank you very much for the pep talk, and something to keep in mind. I usually am.
You know, I don't think of it as a pep talk. I think of it as truth. That's different than a pep talk. I'm not there to pat you on the back. I'm there to just tell you the truth as I know it. It's not the truth for everybody. It doesn't have to be. Everybody has their own truth. I just know that my truth works really well for me. I am a super happy guy. Do I have issues? If you want to call them that, but I don't call them that. People looking from the outside of my life go, whoa, how do you deal with that? I don't deal with it. I go to happiness and joy. I meditate an hour a day.
Right.
I teach my patients how to meditate.
I mean, I believe that my whole life, but then you forget after a while when
you got to be around people that do the same thing that you want to do, who are a step above you, who can pull you up.
Yeah. Well,
if you're around all the people groaning and complaining, you'll be groaning and complaining. You can't be around them.
Yeah, no, I believe you, but then when you're locked down, you lose all your friends. Well, not lose them, but
then go to the internet, go to the radio. It's all over the place. Go to see Nita. Nita's a psychotherapist, and she and I have the same philosophy of life. You do it now. Nita doesn't have people coming back for years and years. She gets them straightened out.
So I got a quote for you from the great William James, the philosopher. He said, "The greatest weapon against stress is," you want to guess?
Joy.
Our ability to choose one thought over another.
That's right.
So
and here's
we're
the other
choosing
thing, Richard.
joy.
That's right. Richard, this may sound crazy to you, but you can choose joy when you're miserable. And how do you do it? Repetition. I am joyful. I love joy. I love Richard. If you're a God person, I love God.
Yeah.
And then when you're saying these over and over in a room where there's no cell phone and nobody can bother you, when I meditate at the office, I do it at lunch every day, I put a sign on the door, "Do not disturb." My staff knows not to bother me. There's no emergencies. Okay? The only emergency for me is I need to meditate an hour a day. That's my emergency. Without that, I'm going to fail. So,
what do you meditate on?
You know, I meditate on my love for spirit and my love for myself and my love for every person in my life. It's all about loving, Richard.
I remember, I think it was
Richard.
Frankel. There was this guy who wrote a book that was in Auschwitz, I think he was.
Oh yeah, that's Viktor Frankl.
Oh, Viktor.
And what he said is, every man with a purpose lived at Auschwitz. I don't know if that's true or not, but that's what his take was on it. And he said those without a purpose all died. Didn't matter if they're healthy, sick, big, whatever. Yeah. It was all about having a purpose. And I was listening to that book in my car on audible.com, and I got to my parking spot, and I finished it up, waiting in the car, listening to that book. And I walked down in my office, and my office looked different to me. All of a sudden, it was bright, and I was grateful to be there instead of being tired in the morning and begrudging my patients. Oh, no. I have to go see 20 patients today. That's hard. I get tired. Blah, blah, blah. My neck hurts. My back hurts. You know, I'm human, right? I have those things. And that book changed my life. I made up a couple of purposes, okay? And I live in those purposes. One is to take care of my family, regardless of how I feel. Number two is to take care of my patients, no matter how I feel. And I believe that Spirit has given me the willpower and the choice to do those things, and they keep me going. Sure, I love golf. Do I need to play golf? No. All of these things we love, we don't need. What do we need? We need to be loving. We need a purpose. That's all we need. Then life is wonderful. And Harold, you clean up what you're choosing, and you're going to be a lot happier guy. If it comes out of your mouth in a negative form, you're not going to be happy. See, my point of view is everyone on the planet has God inside of them. And if you're not going there, you're not going to have God. You don't go to a church to get God. Do you get what I'm saying? You got to do the work inside. And that's time alone. You know, introspection has always been what every philosopher has preached since the beginning of time. Socrates, Aristotle, you know, Nita knows all the recent philosophers, but it's all the same. There's only one message. And it's love.
Well, thank you so much for reminding me of that. And I just have to get my knee to believe it.
Well, you don't have to have a knee to be happy. I've had guys, I'm sorry, I've had patients who have had their pelvises removed who are joyful. I've had patients who have been shot in the head who can't move and they're paralyzed or their spinal cord's been cut and they're happy. A lot of them have said they weren't happy until that happened to them because that's when they found their love for themselves and for spirit. So I wouldn't be complaining about your knee a whole lot. You know, my grandfather was a philosopher doctor. On his desk was a plaque, and it said it was a pair of shoes, little shoes, and it said, I used to complain because I had no shoes until I met a man who had no feet. So get your gratitude going, Harold, and stop the complaining, and you're going to be a happy guy. I don't know if I can help your knee or not, but I'll sure be glad to talk to you about it if you want to come in the office. The phone number there again is 800-300-9300. If you want to see me doing these procedures, go to www.lastemcells.com, lastemcells.com. You can email me there, and you can watch videos of me injecting all of that. Sound good, Harold?
Sounds good. I want to thank you for all this good information you passed on. Remind me of a lot of things.
Yeah, well, you know what? I do it for you, and I do it for me, because I'm human, and I go negative, and I forget too. But I can promise you this. If you don't meditate an hour a day, you won't be able to remind yourself, and you're not going to have me there to keep reminding you.
Right.
You got to learn how to do it yourself. And I just told you the key. If you want more keys, email me from the website. And I'll spend as much time as you need to get you straightened out on a path that works for you.
That's a nice offer.
Thanks again.
Thanks for your
God
call,
bless
Harold.
you, man.
We appreciate you. Take good care. Our number here is 866-870-5752. You can speak to Dr. Darrow right here in the studio. We have a couple minutes left, 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off a very page on the site and watch him performing the treatments on videos. Very cool stuff. And when you phone the program today, you receive the book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What do you think?
I think I should take a quick question before the show is over.
Yeah.
And I'd love to talk to people instead. If you want to call in, now's the time. Excuse me. This is a great question because it's so common. My 17-year-old son injured his shoulder pitching in baseball. Well, of course he's going to injure his shoulder. He's trying to pitch at 100 miles an hour. He's scheduled for surgery. Uh-oh,
Oops,
bad idea.
We are out of time. But it was a valiant effort, though. And thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. Remember to listen to The Pet Show with our pal Warren next time from 11 to 1 every Saturday. I'm your host, Nita Valens. Thanks for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.